I'm very happy and proud to introduce our next presenter, Aziz Ibrahim.
All right. Good afternoon, friends, colleagues, and professors, supervisors that are watching somewhere out in Ontario. My name is Aziz Ibrahim. I'm a public health inspector with the Food Safety Department over at the City of Hamilton, a city where I think Mike knows a couple of things about. Mike's from Hamilton. So my project was on it was a program evaluation proposal of the Food Safety Inspection Disclosure Program. Okay, so I'll just give you a background about the program and the food safety program at large and the inspection disclosure program, which I will be creating, which I've created an evaluation proposal for. So the goals and the requirements of the food safety program, along with all other fundamental public health programs and services, are outlined in the Ontario Public Health Standards, or OPHS. The OPHS, established by the Ontario Ministry of Health and Long-Term Care in 2008, are the guidelines for the delivery of mandatory health programs and services, which include assessment and surveillance, health promotion, policy development, disease and injury prevention, and health protection. So the Food Safety Inspection Program is legislated by the Health Protection and Promotion Act, and under that act, it's legislated by the Food Premises Regulation. So this regulation regulates all food safety inspection programs throughout the province of Ontario, and throughout the province of Ontario, there's 36 health units, so they're all regulated by this one regulation. So the goal of the food safety program is to prevent or reduce the burden of foodborne illness, but more specifically, the goal of the food safety inspection program is to protect the public by achieving and maintaining the highest possible level of food safety in food premises, promote food safety in food premises, enforce food safety compliance with the food premise regulation, and also educate the public and operators on food safety through both formal and informal education. Formal education, which I am an instructor of the food safety food handler certification course. So right here, this is a logic model for the food safety program. So the food safety program is comprised of a manager, specialist, and 12 inspectors. So the manager is in charge of ensuring the effective and efficient delivery of food safety program services in alignment with the OPHS requirement, the OPHS which we just went over, through monitoring and evaluating staff performance and program outcomes. The food safety specialist, who's also a certified public health inspector, deals with public health food safety inquiries, as well as provides guidance to district public health inspector, which I am one of. And then last but not least is the food safety public health inspectors, which I myself am. So we're the field workers who conduct inspections, investigations, consultations, and enforce also food safety standards on food premises. Now, in addition to the main responsibilities of conducting routine inspections of food premises, the program also provides food safety training and investigates, as well as responds to suspect and confirmed foodborne illness. We're also involved with food recalls, food adulterations, consumer complaints, and emergencies that may affect the wholesomeness of food. So next you have a map of the inspection region for the region of Hamilton. Food safety inspections are conducted throughout the region. So this comprises of 3,500 premises within the city of Hamilton. These premises include restaurants, hospitals and nursing home kitchens, fast food outlets, supermarkets, butcher shops, farmers markets, convenience stores, mobile kitchens, home caterers, banquet halls, and special events where food is served to the public. Now getting to the meat of the presentation. So the Food Safety Inspection Disclosure Program, so there was research that was done before the implementation of the program, and we found that, or the researcher from the McMaster, I'd like to give a shout out to, who's from the McMaster Institute of Environmental Health, who works in-house with the city of Hamilton. Her name is Marie McCurry. So she's done substantial research, and she found that research has shown that disclosure of inspection results increases compliance with food safety standards. Now, the Food Safety Inspection Disclosure Program is based on compliance with the food premise regulation, and it's a 3-card inspection disclosure program. So, like Anna, I have something for you guys to view, but unfortunately, you guys can't take it home. It's the inspection cards. You guys can take a look at it and then give it back, okay? All right. So the program, as I mentioned, it was launched recently. It was launched January 1st of 2014. And under the three-card inspection, a green would indicate a pass, a yellow, a conditional pass, and a red card, which would mean there's immediate health risks that are posed to the public, and the premise would be closed and reopen upon a reinspection by the public health inspector, which deems it safe for opening. So the goals of the Food Safety Inspection Disclosure Program, it's to improve food safety standards through increased operator compliance with food premise regulation, increased food safety awareness, public access to information, and transparency so that diners may make informed decisions when eating or purchasing at food establishments within the city of Hamilton. So a couple of issues. Since the three-card inspection disclosure program is a new program without any existing evaluation framework, there was the need to measure the performance of the program and determine public health or public support and satisfaction of the program and the impact and value of the program. So how do we do this? Through the creation, just as a disclaimer, I know my supervisor is watching, this picture was not at the workplace. I was in a hotel actually in Victoria. And also I'd like to add, my wife told me to take this off, but I totally forgot, so I do apologize. Okay, so personally I have a strong interest for public health program management from development to implementation to evaluation and improvement. So the proposal met my program evaluation interest. Also, the evaluation proposal was designed to meet the program evaluation learning component stated in the learning contract, which Betty and Victoria helped me a lot in terms of fitting this practicum experience to my work. So I really appreciate your help. Thanks. Okay, and then for the agency, obviously I had to fulfill their needs also. This helped them determine program successes and opportunities, and also this met the Ontario Public Health Standards, which requires that every program in public health be evaluated on or assessed on an annual basis. So this would fit their requirements also. Okay, so the program evaluation components consisted of two components, the public opinion survey, which would assess the public knowledge, awareness, opinions, and attitudes towards the program, and also the food safety program data analysis, which would be the program performance measurement aspect. So the public survey, the public opinion survey would be made up of a series of closed-ended quantitative questions. The public opinion survey will be available in both hard copy and electronic questionnaire formats. So the electronic the electronic version of the survey will be developed using SurveyMonkey. It's an American electronic survey and questionnaire tool. Although SurveyMonkey is an American-based company and the U.S. privacy laws may be applied, as Kathy had mentioned in the feedback, the decision to use this tool was made due to success in previously conducted public opinion surveys evaluated in public health in Ontario. We also did an evaluation, I think about 2 years ago, and we used the SurveyMonkey, so that's the reason why we went with that. So the link of the survey will be posted on the City of Hamilton social media account pages, as well as on main pages of the Hamilton Public Health page. And then the hard copy, the hard copy will just be a paper copy of the surveys, and these will be distributed by the public health inspectors at study designated sites. Okay, so I'm getting the 2-minute sign. And it'll be through convenience sampling. So here's a blurry, small version of the draft. And then the findings, public familiarity, clarity, it'll determine the public familiarity with the program. Most importantly, it'll determine the confidence level of the program to the public, and also overall public satisfaction and support of the program. And then last but not least, we have the second component, which is the food safety program data analysis. Now, inspections are conducted through, are inputted into the electronic software, which is called the Hedgehog, so information would be extracted from there. And then data will be categorized by inspection process and outcomes, so inspection types, whether it's a routine or reinspection, how many reinspections we've gone to, disclosure card types issued, green, yellow, or red, and also the infraction types. And then there'll be data analysis through inspection completion rates, inspection compliance rates, and the infraction rate. And then this is a sample of what a chart would look like, a typical one. And the findings will help determine, or we'll find out inspection completion rates, number of re-inspections conducted, fines issued, premises closed, and the compliance rates, and also the types of non-compliances committed. So strengths and limitations for the public opinion survey. I think we're all familiar with the strengths and limitations to both hard copy and electronic surveys, but more specifically, I'll just go over, since we're running out of time, the food safety program data analysis. So the strengths would be shortened data analysis period, and also low error data analysis as data is computer generated. Now, possible limitations can be inconsistency in inspection reporting by food safety public health inspectors when they're inputting into the software, and also food safety public health inspectors errors during inspection documentation. And the City of Hamilton does a very good job. We have a quality assurance personnel who actually looks into this, and I carry my work phone with me right now. So he actually emailed me on an error that I did on my inspection. So he's very up to date on these things. Okay. So I just want to give credit. His name is George Rice. George Rice. I give that's your credit. Okay. So that's that. And then the public health implications and conclusion. So evidence-based public health decision-making, evaluation framework establishment. And this is a good example of collaborative public health, because throughout GTA, there's 2 health departments that have this current program in place, and we're able to collaborate with them, and we'll be part of the pioneers of this program. So thank you guys for giving me your 10 minutes. And so just an acknowledgement, I don't think I mentioned his name, my manager and supervisor, Richard McDonald, who's the food safety manager. University of Victoria, I'd like to thank Kathy Worthington, who was the instructor in my first reader, and Professor Michael Hayes for giving me nice feedback on the second reader. And Victoria Barr, as I mentioned, and Betty Taylor, and other public health contacts. Right. And since Harj has started the trend of thanking our spouses, and I don't want to sleep on the couch when I go home, when I go back home, I'd like to thank my wife for all her
hard work. So, questions? Okay. So while you're going to make a comment, I just say hello to those folks in Hamilton who are watching. Hamilton is the second best city in Canada.
Yeah, I know. Yeah.
Hi, Aziz.
Hi.
I'm Pam. I had the pleasure of doing my part-time practicum component with Aziz online for Victoria's class, and I loved listening and hearing from you about some part of public health that I'd never thought about. We have our food inspectors 1 floor above where I work in my health unit, and I never had a clue.
Feelings very mutual. I've learned a lot from you guys, and I want to thank all you guys. Thank you.
Oh, so super interesting topic. Thank you.